are recording this meeting. I just started the recording that way for those who couldn't join us today. We can share it with them later via our YouTube channel for the agency. And that way, if we need to go back and refresh our memory on some of the things you guys shared or vice versa, we can use the recording for that. So the recording is underway. And with that, Brittany, I'll turn it over to you.
Okay, great. Thanks, Matt. I want to just welcome everybody and thank you for joining us tonight. This is our launch meeting for our DD-ABI family engagement group that we are just starting as of now. So thank you so much. I'm excited to see and talk with all of you tonight. We do have an agenda that will probably put us to 7 o'clock tonight. So my name is Brittany Halligan, and I'm the Associate Executive Director for our DD-ABI services, which is Developmental Disability Acquired Brain Injury Services. So I oversee all of those services, which includes residential and community hub, day hub, self-direction, outreach, and our, I think that's it. Is that it? That might be it. So anyways, this is my 20th year at AccessCNY, so I obviously am seeing some familiar faces, which is great. And then I would also like Paul and Sue to introduce themselves, and then if we could have everybody who is here as a family member or advocate to just introduce yourself and let us know where your loved one is receiving services, so we're aware. That would be great, and we'll be able to reach out and communicate post-meeting. So Paul, I'll turn it over to you for now.
Thanks, Brittany. I'm Paul Jocelyn. I'm the Executive Director of AccessCNY, and I've been with the organization for 5 years now. I've been in the field of developmental disability services for a little over a dozen years, and prior to that, I worked in the for-profit world. So nice to meet everybody.
Good evening. I'm Sue Schultz. I'm the Chief Operating Officer. I've been with AccessCNY for 36 years. In various programs, and then in quality, and then in chief operating. So welcome.
I will move through the screen here. Joanne, Joanne B, do you want to start?
Sure. I'm Joanne Braunley, and myself and Sue Ditterline are Carol Schick's sisters. She is a resident at North Star Apartments and has been with Access New York and TLS prior to that for probably close to 4 decades would be my guess. Long-term program recipient.
Thank you so much for joining us. Susan?
Hi, I think I'm off mute. I'm Carol Schick's other sister. I live in South Carolina, so I'm basically phone support most of the time.
Nice.
That's right. I'm in Rochester, New York.
And Joanne and Mike?
Connected to Chris Kelly, who lives at the Spalding residence down in the valley. I'm his brother and my wife Joanne, and we're his guardians, so we're interested in checking in with you today.
And also Chris has lived at that Spalding house for 35 years.
Right. Great. Thank you for joining us.
Thank you.
All right, and then I'm just seeing phone numbers. So how about 559-0047?
That would be me. My name is Marilyn, and my son is Marquise Mitchell, and he uses AccessCNY. He goes to Sunrise. Well, he hasn't been to Sunrise since COVID, so but he has privileges at the YMCA and Unique Perspective. His case manager is Rick Wellman. So I received this email at my email address, and I'm just calling in tonight to see what it is about.
All right, great. Thank you, Marilyn.
Yeah.
All right, phone number 382-7562.
Yeah, this is Mike Burns. My sister Kathleen is a resident at Highbridge A, and she was originally with Spalding for over 30 years. And she has a day program at Menora Park. And I too am here to just hear, and I'm most interested in recruiting and retaining staff. We have a niece who also needs services, and I think gets some services already from Access.
All right, great. Thank you so much, Mike. All right, 771-5956.
Mr. Advocate. Oh. Hi.
Hey, how are you?
I don't know if you heard. I don't know if you heard any of that. Said I was just unmuted. Did you hear any of it?
I didn't. No, just the tail end of it.
Oh, okay. All right. I don't know. So my name is Joan Smith. My son is Brad. He lives in a large home, and he receives services through Advocates.
Okay, great.
And Lark, of course.
Okay.
Yep. He's
Awesome.
trying to dial in too now, but he said he's having a problem. So I'm texting in the middle of talking, so I'm sorry.
No, you are just fine. Thank you for joining us.
Oh, thank you.
All right, and 299-8065.
Yeah, that's Len Paduano, that's me, and my wife Judy will be joining us shortly on the other phone. We have Michael Sidney, who lives with us. That's my stepson. And up until about a year and a half ago, he was doing the DD-ABI on Court Street. 3 days a week, plus he bowled from his wheelchair. So we're interested in getting him back there, and I definitely wanted to make sure that everybody was vaccinated and all that. And we've all been vaccinated, so I was going to check to see about the drivers that pick them up. Hopefully they've been vaccinated.
Okay, great. Well, thank you for joining us.
Mm-hmm.
All right, so we will go ahead, and I'm going to pass it over to Paul, and then I will be back for the next topic.
We wanted to start today's meeting with a little bit of a history on developmental disability services, because I think it really helps frame why we thought it was important to get together with families, and why family engagement is so important to our field. So I'll start with going back to it sounds like a lot of you guys have been involved with services for people with developmental disabilities for a long time, so you may very well be familiar with this history, but again, it helps.
Can I break in? I didn't get my number called, and I just wanted to make sure I was connected to you. Hello?
You are. Please go ahead and introduce yourself if you would.
Margaret Swanson. My number is 619-423-3612. I live in California, so I have little contact lately. I haven't seen my daughter Kimberly, who lives in Mansfield House in Camillus. She's been a receiver of services for over 20 years, maybe close to 30 years. But I haven't been able to see her for the last 2 years, so I'm quite interested in finding out what's going on. Thank you.
Well, thank you for joining us, Margaret. Appreciate that. So I'll try to make the history lesson pretty quick. So many of you guys probably heard of Willowbrook State School back in the early 70s. It was a subject of a lot of press and a lawsuit brought on by families of the 5,000 people who live there because of the, I'll call it, inhumane living conditions at Willowbrook. And that really was the genesis of the OPWD, the service system that we have today for people with developmental disabilities. That movement and that lawsuit really created a lot of the group homes that we have today, the IRAs. And it was also the reason why a lot of AccessCNY legacy organizations, TLS, Enable, Spalding, Larsh, they all started right around the same time and started to develop group homes. And it didn't take long for New York State to learn back in the early to mid 70s that they could save a lot of money by using Medicaid to fund those group homes and a lot of the other services that we have today. And that was both good and bad, and that it saved the state some money, and it allowed many different services to begin. And we're blessed in New York to have what is probably the largest, broadest system of supports for people with developmental disabilities today because of that Medicaid funding. But a lot of people also believe that that funding caused a disconnect between families and agencies. There's a lot of regulations, and it may very well be that some families, you guys, but just by being here, have demonstrated that you want to stay engaged with services, but a lot of other families, I think, have disconnected because they feel like agencies like AccessCNY can properly care for their loved ones who live in homes or receive other services. So we really wanted to start this group for a few reasons. One is to sort of bring back some of that family engagement that was happening back in the 70s and over the following decades, because we're in a much different situation today than we were then. Today we have a commissioner of the Office for People with Developmental Disabilities and a New York State budget director that have a much different view on services for people with developmental disabilities. They feel like the growth in spending has to stop, and if there are more people who need to be served by agencies like AccessCNY, that we have to serve those people using the sort of the same pot of money and do it in a lot less costly way. And so AccessCNY has taken on a couple different initiatives based on that attitude that exists in New York. First, we were one of the founding agencies that created a family advocacy group in Central New York, aptly called the Central New York Disability Advocacy Group. And that group has really done a great job of being the voice of families in our Central New York region and making sure our local elected officials and people in Albany understand their concerns. And Matt, who's on the phone with us today, can talk more about when that group meets for anybody who's on the phone today and wants to be a part of that. And then the second thing we've done is what we're doing today, is launching this engagement group to, like I said earlier, really try to bring back some ties that once existed between families and agencies like AccessCNY. A few ideas that we've talked about in as far as what direction this group can take, and we certainly want to hear from the families that are on the phone about what your concerns are, how this group, as we continue to meet, can answer your questions or provide information to you. But a few of the ideas we've talked about, one is to hear from you on how we can improve what we do, how we can make our services better, do a better job of supporting your loved ones. Having said that, for the purposes of meetings like this, we do want to keep those discussions more broadly and not really talk about individual circumstances. Certainly, we would very much like to talk one-on-one with you about specific concerns about your family member, but as a group, we want to keep the discussion more broad. A second idea that we've talked about is maybe bringing in some speakers to provide educational opportunities for families. Things like financial planning for families or estate planning. That information might be helpful to folks. And then lastly is to talk about how services might be changing so that we can be upfront with families about what the direction that New York State is taking services, and talk about ways we can continue to support your loved ones in a safe way. But as I said, we're certainly open to hearing from you directly about other ways we can use this group to better inform families. And with that, Brett, I'll turn it back over to you.
Great, thanks, Paul. So I wanted to start by talking about what is always at the forefront of our minds, and probably yours as well, which is staffing, recruitment and retention of staff. We are experiencing right now, hopefully towards the tail end of COVID, or almost into the second year of this, a really high number of sorry about that. So anyhow, we are experiencing a very high percentage of staff vacancies and high turnover, which has been a problem for 20 years, but it is worse now than what we've ever seen, and either due to unemployment rates or COVID or whatever the reason may be, that has been a top priority for the entire administration at AccessCNY and our executive team. We have been meeting weekly on Monday mornings to review job postings and try to change the wording and to make it more catchy. We've talked about different advertising efforts. Our Associate Executive Director of Human Resources has met with Google and different platforms. We've expanded our platform when it comes to online posting our positions that are available. We have moved our orientation to completely online to make it easier for people to apply and to receive training if they have other jobs. We have implemented quarterly bonuses to make an effort towards retaining the staff that we do have and rewarding people for different reasons. We have different criteria for each quarterly bonus. We have evaluated our starting salaries and have been able to increase our starting salaries, well aware that as the minimum wage increases and fast food services increase their wages, that we have to stay competitive. And so we're constantly evaluating that. We have worked with Matt and his team, like I said, about enhancing our advertisement efforts in the community and making it easy for people to know about AccessCNY opportunities and to also apply. So that is something that we are constantly working on, and we have increased our referral bonus for our current employees if they refer a friend or family member. We have also expanded the eligibility of who is eligible to receive that bonus all the way up to our program directors. So we are also open to any and all ideas towards recruitment and retention. We pride ourselves in making a culture here at AccessCNY that is family friendly and flexible. And I think COVID has, if anybody wasn't like that before, you have to be it now. But we have prided ourselves in that for 20 years. And I think that's something that we're really good at. So we try to make it a culture that is accepting and an open door policy, and one that's understanding and flexible. And I think that that's really, really important. So that is just something that we are constantly talking about. I don't know if anybody on the call today has any additional comments or thoughts around recruitment or retention, or something that maybe you are familiar, you know, in your own line of work that you've done that you found successful or have thought about. But I would love to hear from anybody who has any thoughts or ideas today.
This is Mike Burns.
Mike.
I'm just wondering, when we try to compare a direct service professional position that AccessCNY can offer to a position offered by the state doing the same work, how do we compare? And have we considered lobbying the state for better benefits for our own workers, you know, to try to raise the scales and raise the level of benefits for people in AccessCNY to match?
Yeah, Mike, we have absolutely looked at our benefits package, and AccessCNY really does have quite an attractive benefits plan. When we look at the other providers within the region, I would say we're at the top when it comes to that, whether it be paid time off or the flexibility with schedules, the amount of programs that we serve. If somebody needs Monday through Friday, 8:30 to 4:30, we can find a slot for them. We also, our health insurance, we do a high deductible plan, but AccessCNY covers the first 80% of that plan, which is very generous. We've really been able to do quite a nice job with our benefits package, and that's something that whenever I'm offering a job that I really tend to focus on. And I think that's something that really helps us with recruitment and retention. So I am proud to be able to say that. I think when you look at our starting salaries, any non-for-profit provider agency in the region compared to the state or OPWDD run or operated facilities, there is a significant difference, and they are at a tier that non-for-profits just cannot compete with. We could not sustain the salaries that they currently implement. Paul, I don't know if you want to add anything to that, or Sue.
No, you hit the nail on the head, Brittany. So just yesterday, there was a hearing that Senator Mannion managed, and Commissioner Kastner, who's the Commissioner of OPWD, announced that they will be increasing the wages for state-operated staff to, I think it's something around $17.80 an hour, which is, as you pointed out, we can't compete with that. And there is a strong legislative lobby effort from all the provider associations across the state that we should be on par with them. And so I think part of your question, Mike, was around advocacy, and that's a huge part of that lobbying effort.
Yeah, because that's really what we're competing with and trying to staff, and we're starting with a deficit there already.
Great point. Great point.
Yeah, absolutely. Any other ideas or thoughts around staff recruitment or retention? Okay, Sue and I want to just answer any questions you might have, but also review the opportunities that we have provided to staff around COVID and the different practices that are currently implemented around safe practices to keep our staff and the people we serve safe and healthy. So right in the, I guess it was the beginning of the end of January 25th, we had Dr. Papone from U of R come and do a town hall and provide education around COVID and do Mythbusters and answer staff's questions to make sure that our staff are as educated as possible around the vaccine and promote getting the vaccine. We have had a strong push ever since the vaccine was available. We are frontline workers and we're in the first tier. Many people who provide that direct service were in that first tier of people eligible to receive the vaccine. So we have focused on that ever since to try to encourage our employees and obviously our participants to go ahead and get the vaccine and make sure that if they did have any concerns or questions that they had the opportunity for those questions and concerns to be answered. We also, in the end of July, I think it was the 29th, had Dr. Bragman from upstate come and also do another town hall. The staff that we have that have not received the vaccine to date, we did a strong push to encourage them to attend so that they are as educated as they can be, and that if there are myths or thoughts out there that aren't true, that Dr. Bragman could address them. So we also provided that. We've done different FAQs and Mythbusters. Our Associate Executive Director of Quality also provides weekly updates and educational materials on a weekly basis. We hosted vaccine clinics so that our staff could come right to Court Street and receive the vaccine. We also facilitated 2 different times with Syracuse Community Health Center where our staff were allocated, I think it was almost 100 both times, vaccines, and that was very successful as well. We have re-implemented with the Delta variant all of our screening and safety cleaning, all of those practices. And all of our staff, regardless of their vaccine status, are required to wear masks when they are working and delivering service. We also have re-implemented all of our screening for visitors at our IRAs, at our 24-hour houses. And we have decreased the, we've done limited room capacity when it comes to meetings. So we are encouraging people to, again, if you're able to do your job remotely, to be able to do that. We obviously know that our direct care are not able to do that. So implementing those practices and making sure that we're consistent in doing everything that we can to make sure that we're keeping everybody healthy and safe is our top priority. There, obviously, Sue, do you want to address the vaccine mandate that the Biden administration has discussed?
Sure. So I'm sure everyone has heard that the announcement about vaccines being mandated in various sectors. And right now, it is an announcement. We haven't gotten a lot of information on it, so we will continue to follow the direction of OPWDD and our county and our government offices. So we don't have a lot of details right now. And as we get more, we have been sharing that with staff, and we can always share it with families as well.
Thanks, Sue.
Sorry to be vague on that, but we don't have a lot.
Right. Does anybody have any questions about current practices or past practices that we've done, or any questions about the vaccine or staff vaccination status? We have tried throughout the pandemic and since the vaccine has been available to meet all of our employees where they are and to just make sure that we're providing as much education and guidance as we can. Like I said earlier, we have, as an administration, strongly encouraged everyone to get the vaccine and created opportunities for them to be able to do that and to be the first ones to be able to receive that. We still do have a significant number of staff that are not vaccinated. And like Sue said, we don't know what the future will bring for that, but we will absolutely keep people posted, and that will be a future topic at this meeting as well as we learn more information.
And I think it was Lou and Judy. Did you guys have a specific question you wanted addressed on vaccines? Just so I don't want to miss that, because I know you mentioned it in your introduction. It looks like we may have lost them. So I guess if they pop back on, we can readdress that question. And I guess, Brittany, one thing that these topics that you mentioned aren't unrelated, right? The staff vacancy rate and the vaccines are pulling against each other, which is very difficult to manage. So we're waiting for the guidance from the Biden administration on what all this could mean, but certainly have effects on recruitment and retention as well down the road.
Absolutely.
So I'll just ask one more time if Lou and Judy are there, if you want to rephrase your question. All right, I guess we'll move on.
Feel free to reach out to me, after this meeting too, if you want to discuss something specific to networks. So.
And you are?
Hi, I'm Brittany Halligan.
Okay, and what would your phone number be?
It's 315-243-3943.
Okay.
All right, so we wanted to give an opportunity to everybody who was in attendance today to just ask any question about any topic or talk about services or any questions that you have about services. So if anybody has any questions or wants to bring anything up or talk about any future topics or unmet needs in the community, anything really at all that you'd like to discuss today.
Hi, Brittany. This is Joanne Kelly. Can you hear me?
Hi, Joanne. Yes, thank you.
Hi. I just want to ask what the agency is doing for staff who may, for whatever reason, be hesitant about the vaccine or be not interested in the vaccine. Since staffing is a problem, how you're going to retain those people?
Yeah, so what we have done at this point is just meet everybody where they're at and provide education and opportunity. We are having managers and directors talk to the staff that are not vaccinated just about if they do have any questions or what is causing the hesitation to get the vaccine, and then asking that those managers and directors provide that feedback to executive teams so that we can look into their concerns and get that information back to them to try to break down those, the misinformation that's out there that people might be hesitant to get it. So we're in the process of doing that right now. We just had the second town hall with Dr. Bragman from Upstate who highly encouraged the vaccine and discussed with our staff the benefits of doing that and why you would want to do that. That was on July 29th. So we continue to just have the conversation and try to figure out why people are hesitant and then just address that. We have not, as an agency, mandated the vaccine. And like Sue just said, with the Biden administration, the mention of possibly any employer who has over 100 employees, that being mandated or weekly testing, there's more to come on that. We don't have a ton of information, but we will figure that out as we gain more information. Does that answer your question?
Yes, thank you.
Okay.
In the town hall that we had with Dr. Bragman from upstate, I would say she was prescient in saying that your choice is you get the virus or you get the vaccine. And that's really, as a community, you kind of see that happening now with the Delta variant, that even if you get the vaccine, you might end up getting the virus as well, but a much less severe case. And that's the message we're trying to send the staff is you either get the vaccine or you'll likely end up with the virus. And we need to protect those that we serve. And that was a very strong message that she sent to our staff. And we did see a nice uptick in staff who had been hesitant, some choosing to get vaccinated. So as Brittany said, people are in different places and we're trying to meet them where they are and give them as much material as we can to encourage them to get vaccinated.
I could just jump in there, and Brittany, you talked about this a little bit already, but we've also continually tried to address a lot of the, I'll call it misinformation that's out there. So early on when vaccines were first available, there was a lot of concerns and speculation around side effects, for example. And so we provided a lot of information around, the occurrence of those, what they look like, that the relatively infrequency that when they occur, the infrequent occurrence. And then more recently, a lot of the information we've been getting from staff who are still hesitant have been around breakthrough cases and, using that as a reason for not getting vaccinated. And there again, we've really tried to provide some fact-based arguments against why that message is not correct, that the breakthrough cases that are coming are from the majority of the population that is now vaccinated. I think it's roughly 3/4 of the population. So we have tried to continually educate and explain the misinformation, the misguided thought process that's been out there as well.
I have a question or a comment. First off, kudos to everybody for setting this up. This is like the most communications that we've had from Access in a couple of years. So I really like the forum and I think it's very, very helpful. The concern is on communications on a more specific level. We don't get any. We don't know when staff change. We don't know who the day manager is. We don't know who to call if we have a concern. We don't hear about review meetings, but we'd like to participate. One of my questions is there any chance that those would go virtual or video like this? Because then those of us who are out of town could actually participate easily. How do you suggest we address, critical communications? I'm not talking about the day-to-day stuff, but how do we be kept informed for the main communication channels and things that are going on?
Brittany, would you mind if I address that?
No, that's okay. Go ahead.
Okay. Joanne, and the rest of the group, I'm Marilee Gorton. I'm the Associate Director of Residential Services. So
you're in contact, so I have spoke to you about this. It was a couple years ago. I think you were the last person I heard from. Okay.
Okay. So I would suggest that we talk again, and perhaps we can set up another meeting similar to this one. So both you and your sister are present. Okay. And I can, hear from you what your concerns are. It sounds like it's around communication. And then I can put you in touch with the director of the program, who is Adam Santana there, and the manager as well. And then we can, I can take a step back and you and the manager and director can work out the level of communication that you are interested in and comfortable with, and that your family member is comfortable with as well. So it really is a process, because that level of communication differs. Preference is different for each family member and each person we serve. But we definitely want to be inclusive and help you ensure you have, as a family member, the information that you need to support Carol and your loved ones, all of you. So why don't I can put my email address up in the chat and my phone number, and reach out to me, or do the same yourself, and I'll reach out to you, and then we can talk more specifically how to move forward in a way that resolves this concern.
Okay, that would be very helpful. Thank you.
All right, any other questions or comments?
I just have another general one. Given that so many of the programs are funded through Medicaid, and that's always a risk financially, are you hearing any news of major cuts or anything that you see impacting programs or ability to support residents and participants?
I can take
Other
it
than
first.
the normal annual budget.
Right.
Yeah. So I can start to answer that question, and Matt or anyone else on the phone, feel free to add. So in the last year, it's actually been the opposite. We've seen, and it's partly due to the pandemic, but it's also, I think, partly due to a change in the federal administration. The President Biden's American Rescue Plan was sort of the first step towards increased funding. And that will be providing a significant amount of money to New York State's Service for People with Developmental Disabilities, something in the neighborhood of $700 million that will be primarily focused on workforce and finding ways to stabilize the workforce. And then past that, the Better Care, Better Jobs Act that is currently being negotiated by the federal government is a longer term, 10 years, I believe, enhanced funding for services for people with developmental disabilities, specifically home and community-based services. So right now, the trend has been a very positive one compared to what has been in the past.
Yeah, and I would add to that Joanna, it is like a roller coaster oftentimes, that sometimes it seems like the sky is falling. Right now it feels like the sky is opening up, and that there are new money coming into the system. And a lot of it is, what's through some of the COVID acts is maybe one-time funding, but the Better Cares, Better Jobs Act is more long-term funding that will give us new opportunities. And I think that's one of the reasons that we wanted to start having these conversations with families, is we want to know what their needs are in the community that aren't being met, what your loved ones need that maybe we haven't thought big enough because there hasn't been the funding to make that possible. And there's certainly no guarantees, but with lots of new money coming into the system, whether it's one time or will be ongoing, it gives us the opportunity to try new things and be creative in ways that we haven't really been able to do over the years. If you look at some of the agency's services, and I think of self-direction as one of them, these things were tried as one-time projects that are now programs that are ongoing because they succeeded. So part of this conversation is to know what needs aren't being met, so we can start brainstorming how we can meet some of those needs for those that we serve.
Thank you. That's encouraging to hear. Good to know it can happen.
We don't often get to have that good news, so it's nice that we can share it. So thank you for the question.
Else? Okay, well, Matt is I'm going to pass it over to Matt. He's going to talk about a post-meeting survey, and then I'll take it back and we'll talk about the next meeting date. But I want you to feel free that in that post-meeting survey to add in any questions or comments or things that maybe you forgot to mention today or wanted to mention, and use that as a platform to be able to do that. So
in the next couple of days or the beginning of next week, probably between now and this time next week, we'll be sending out a survey, not just to this group, but to a larger group of individuals for you to share kind of your ideas and questions. We found that as we meet with staff in these types of forums, there's maybe something that comes up that you didn't think of during the meeting, or something you weren't really comfortable asking in that setting. So the survey is meant to give you an opportunity to express those things and provide that feedback to us, so we know, for instance, what topics you might be interested in and learning more about, telling us, as Joanne did, what's not working, or some things that maybe are working, and or what community needs aren't being met. So the survey that you'll receive is kind of about the session, but more broadly about the services that we provide and how we can provide those services better to your loved ones. Also, part of that will just be a sense of, we want to continue to have these meetings. Does this time frame work? What's the frequency of them should be, so we can continue that open dialogue, because this meeting is really about what the needs of your needs are and the needs of your family members. So when you get that survey, we do ask that you take some time to give some thought to it, and what you want to get out of these meetings, and how we can improve AccessCNY services. So look for that survey in the next week or so. Brittany?
Okay, great. Thanks, Matt. We were looking at, this is the third Wednesday of the month, but we were going to look at the next meeting, and it doesn't mean that we will do this group meeting every month, but we did want to just meet in October. So I'm looking at Thursday, October 27th at the same time, 6 o'clock, and was wondering if that date and time works for most of the people on this call today.
But there is more to the story. ABC News has learned that it wasn't just millions.
Yes,
that looks
good.
Yep. Okay, good. Joanne, yes? Okay. All right, so we will plan on that. Oh, does that look good?
I want to clarify, that's Wednesday, that's a Wednesday, right?
Yes, it's a Wednesday, October 27th.
Mike Burns, this is good for me.
Great. All right, and we will send out again an invitation to that meeting, just like we did today. Matt, are you going to do that? Is it going to be a mailing, or are we going to do that via email or text alert?
We'll probably do it in as many methods as possible to get as many people as possible to this meeting.
Great.
So, yeah, look for that in whatever way you got the invitation. We'll do it the same way, so we'll make sure everybody can join.
Okay, perfect.
And on that note, Matt, if I could just ask that if any of you have contacts with other family members of the people we support, please help us spread the word about these meetings. We would appreciate that support to get as many people here as possible.
All right, great. Well, thank you again for joining us. And I will plan to see all of you again on Wednesday, October 27th at 6 o'clock. All right, take care. Be well.
Thanks, Al.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Welcome. Thanks.